a space where we can, oh, there we go. I was actually about to ask if we were recording this. Perfect. So if you did not catch that notification, we are recording now, and that way we can share this later on. And if you have something that you want to talk about that you don't want necessarily recorded, just send it to me in a private chat through the questions, and we'll still be able to answer your questions there. But yeah, like Samantha said, my name is Jason Elliott, and I do live here in Charlottesville. And I figured kind of to get us going today, I had like this little PowerPoint thing, but so often presentations are just not personal. And today is really a day about talking with each other, learning from each other, sharing experiences, if that's the case. So I've got some notes here onto the side about things that I know you all want to cover, but I would welcome you to put in the chat anything that you would like to discuss a little further. If you have questions about things, what I always like to say in the very beginning is that we are right now creating a safe space for all of us. A safe space is one where we can ask questions, where we can not know the answers to things, where we can grow, where we can be safe. And that's so important in this environment of learning. And I think that's also really important in our environments for things like healthcare. And as providers and as patients, we deserve that space. So learning is where we are. It's not where we want to be. So it's okay not to know. We're here learning today. And today, some of us know a whole lot, and a lot of us know a little bit, and some of us don't know anything, and all of us know nothing. So feel free to ask those questions. But this is a safe space, and I will wrap that piece up by saying anything goes and everything stays. I have some information to share with you about myself personally, and also what I do in my professional life, and then of course representing the community as a whole. So truly anything goes. If you have a question, I welcome them. So I'll be keeping an eye on the chat as we go through. And if I do miss something, Samantha, if you can be kind of like my dog handler and just let me know that I've missed a question, that'd be great. So a little bit about why I get to be here today. One, because I guess I just so happen to have that first search button on social media when you look up my name. But really why I'm here is kind of a culmination of two pieces of my life: my professional background and my personal life. And I figured we would start there just so you know a little bit more about me, and then hopefully one day when we can meet in person, I'll know a little more about you. So I have worked in public health now for a decade. So back when I moved here to Charlottesville from Virginia Beach 12 years ago, I was studying at UVA and got my degrees in social sciences and psychology. And I started working at an HIV testing center that was in town at the time. And that was a surprise for me because I thought I was going to go into the ministry. And it just so happened that the ministry turned out to be something a little bit different. But I worked in HIV prevention and sexual health education there at that nonprofit health center for several years. And then about 8 years ago, I moved over to the Virginia Department of Health with the Blue Ridge Health District. Now, I will say at that point right now, I'm not representing the health district, but I will get to share with you later on some of the things that we've done to create a safe space in our clinics. I have worked in several roles there, including running our HIV testing programs and sexual health education efforts. I also worked as a disease intervention specialist in our epidemiology side, and basically worked with the containment and tracing of infectious diseases like HIV, syphilis, and other complicated sexually transmitted infection cases. While I did that, I covered a large portion of the state and was doing a lot of that work when this little thing called COVID came around. And 2 years ago, moved over to the communication side of things. So it's a passion of mine to communicate information in a way that's understandable and enjoyable. So hopefully we can do that today with some of this. But that gave me a lot of insight on maybe the areas of potential and of growth, particularly as medical providers, that we can provide to our community members, our clients, our patients, and a lot of good things came out of that time. The other side of why I'm here is my personal experience. I do identify as a member of the queer community, and I love my community so much. I host about 2 or 3 queer socials every month for individuals in the greater Charlottesville area that just want to get out, go hiking, play games, have a happy hour, go to the theater, have a picnic, and I will give a shout out to some of the people who are here today who have hung out with us at these socials and gotten out and about, and I love that. I also travel as an entertainer, and I have a past as a female impersonator and drag queen, and in some male entertainment as well. So I try to touch all the sides of the community. So when I say that I've got personal experience and I'm open to your questions, that's why. A couple of things just to kind of set the standard of why conversations like this are really important. A lot of times we will hear, and I will also say, as I'm doing this, please ask questions as we go. Like I said, I've got information I want to go over. I don't like talking to you. I like talking with you. So I would much rather, if you have a question, like raise your hand or type it in the chat, and we can just completely go that route. My plan is to power through all of this stuff if y'all don't talk, and then we're just going to sit here awkwardly. So a couple of things about LGBTQ plus individuals. A lot of people say it's such a small portion of the population. Why does this even matter? And maybe that's true. The majority of people in the world may not.
Mm-hmm.
Oh, is that a question?
Yes, I tell you, she know everything. I can't talk. That's why I just try to be quiet. I got drama too, according to her.
Hey, just a quick reminder to everybody to make sure you're muted. Sorry.
I was really excited because I thought someone already had a question.
You're like, they're so excited with their question. They're coming off mute. They're not even going to use the chat box. They were so excited. So just make sure you're on mute, everybody.
Unless you have a question to ask.
Unless you have a really awesome question. Do it.
I'm the type of guy, if you come off mute, I'm gonna make you ask a question too. Yeah, so a lot of people will say that it's such a small portion of the population. Why does it even matter? In 2012, about 3.5% of Americans identified as queer in some way. In 2017, that had increased to about 4.5%. And the last time that we did a massive poll, it came out to just over 7%. So we're seeing this steady incline. And I personally think that that relates to a couple of different things. One, maybe our definition of what queer or LGBTQ plus is means more people can identify that way. I also like to think that we're becoming a society where we're a little more welcoming of people who do identify somewhere under the rainbow. And that's why that number has gone up. And then the other option to that is that it's always been that high and it's always been that higher. Maybe we're just now starting to get a feel for what's actually happening. But people would still say 7% of the population, that's such a slim little bit. That's where I'll tell you that only about 2 to 6% of Americans are redheads. So if you know a redhead, you can do the math. So I think that's really important to remember because of the impact of identifying in this community. Those of us in this community are at a higher risk for a lot of things. We're at a higher risk for mental health issues such as depression, anxiety, eating disorders, and other body dysmorphic diagnoses. We also are more susceptible and likely to be using tobacco products, and therefore then we are at much higher risk for the cancers and other health-related issues that come from tobacco use. We are more likely to not seek medical care. A lot of that has to do with affirming medical I just lost my words, medical sites where we can go in and get affirming care. And when we go into a doctor's office and we're a man who's having sex with other men, we may not relay that to our provider because of the stigma or the misinformation, and therefore not get the tests that we need or the treatment that we deserve. And that is where I will tell you one quick story about why I'm so passionate about inclusive healthcare. And it goes back to a certain school that I may or may not have attended, if you know this. If you know that ring, then you know what I'm talking about. But I was a student at a particular university that shall remain unnamed, and I had become very ill. So I went to student health, and I had reason to believe that it may have been an HIV infection. When I went in, I simply said, I need to get a full line of STI tests done. I'm not feeling too well, and I think I need to get that done. So they're like, yeah, okay, no problem. So they came in and they asked me a set of questions, like, do you have a girlfriend? And I said, no, I don't. And they're like, oh, okay, well, whatever girl that you're sleeping with, then does she have an infection? Nope, she doesn't. Oh, okay, so why are you here? I just think it's a good idea for me to get tested. Okay, that's fine. No problem. So they did all the tests, and I answered their questions honestly. The problem was they were asking me the wrong questions. So when my test came back and I saw that HIV was not on the list, I went back to student health at said university and said, I'm missing a test here that I really wanted to have done. Can you tell me a little more about why you didn't do that? Or is the lab just pending? And they said, oh, that's only a test that needs to be run on gay people. And the problem with that is that it's not just an infection for gay people. And they didn't know whether I was or not because they didn't ask me the right questions. So that's when I actually fell into HIV care as a provider, because I went to somewhere that did ask me inclusive questions. And they did talk about who I was having sex with and why I thought I was at risk for HIV. And they asked questions in a way that I could answer them honestly, and we could move forward together. I will say that when I started working for the state health department as an educator there, my very first place that I got to go do a safe space training and inclusive health presentation was student health at said university. And I absolutely loved that opportunity. This is where I will also keep saying, put your questions in the chat. So a couple of things that I would like to go over with you kind of like as a whole. I know Samantha wanted to talk about specifically about Pride Month and kind of what it means and why it's important to us. So for anybody who is not aware, Pride Month traditionally, globally, nationally, is honored and celebrated in June. So June is known as Pride Month. You will see some other areas in the country or around the world celebrating at different times. For example, here in Charlottesville, our Pride is the middle of September every year. In the past, Virginia Pride has been specified as September, so many Virginia cities were having prides in September. Since then, we've branched out quite a bit, and there are Pride festivals in the Southwest that happen in April and May, in the East that are happening in June and September, in Richmond in September, up in Northern Virginia in August. So we're really celebrating all year long. But National Pride Month is recognized in June, and particularly stems out of a particular incident that happened at Stonewall up in New York City, where an activist basically said, "I've had enough." That started this idea that we no longer want to be slinking in the shadows. We want to stand up for ourselves, and we want to provide for our community. We want to be a community, honestly. And so at that point, June really became this like momentous occasion where we could look back and say, you know what, let's celebrate the accomplishments of the people in our community. Let's honor the future, and let's really do all that by working in the present. So June has become the month that we go to for Pride Month. And it's really great. We see a lot of festivals that are happening. And so if you're not familiar with what happens during Pride Month, oftentimes we will have Pride festivals like Capitol Pride in DC, was just a couple of weeks ago. We're also in the midst of places like Pittsburgh, San Francisco, Chicago, LA, Prides all happening, our major cities. This weekend is New York City, so if you're in New York, go celebrate Pride. And at these events, many things happen. Usually there's a parade that's going to happen, and companies, organizations, individuals, clubs, communities will get together and march in a parade to bolster visibility and to make sure that we as members of the community know that they are our people, and also that those who do not identify within our community also know that they support queer individuals. You will have a lot of things like drag shows, you'll have concerts and food trucks and all kinds of entertainments, but you'll also have things like education sessions where activists will get together and talk about their history in the community and why they're so passionate about what they do. You'll have art openings featuring queer artists. You'll have special dinner parties. You'll have house parties. It's really a time that combines celebration, momentum, and memorial. And that is really what June is, and what any Pride Festival is that you see. Great.
I was going to say, I have a question too. So we have a few coming through right now. Yep. If you don't mind, Jason, I'll just kind of start at the top because I had a couple direct messages as well.
Great.
So I'm going to start at the top, if that's okay with you.
Please do. And then once you get past your top all the way to the bottom, I will start on my top on the bottom, and then we'll go into the everyone ones.
Yes, I love it. Okay, so as an organization, and I know we may have some people joining us from all over UVA. This was specifically for UPG, but I'm going to say for all over UVA, what do we need to do to make sure our LGBTQ+ brothers and sisters feel included, so loved, and feel safe to come to us for anything? I love this question about allyship and how we can be awesome allies in the community. So yes.
Absolutely so. I always say we can't have a queer community without queer allies. We need our allies behind us, sometimes in front of us, and always beside us. And so I will say to anybody who is here as an ally personally, thank you. I would not be alive today if it weren't for the allies who are in my life who helped me push through. And you may never know what person under the rainbow is able to live there in their beautiful, colorful life because of what you do as an ally. So that is the first thing that I would say, is for a lot of us, we love to see the fruits of our labor. We love to see immediate results. We live in a microwave society where everything happens just like that. Building allyship and fostering community, it's not something that just happens overnight. It's something that takes time. So I would say, first of all, don't feel defeated if you don't see someone immediately accepting that love or feeling that warmth. It is a consistent investment that you're making in those individuals and in this community. So that's the first thing. The second thing I would say is, a lot of times we feel like we have to do something. And for me, and I will speak a lot for me because I can't speak for everyone in the community, but for me, it's not about what you're doing as much as what you're not doing. So for me, I love when the allies see me as a whole person. I'm a queer man. If that is the only part of my life that you can see and fixate on, you're missing a lot of me. And so the best allies, I feel, are those individuals who are able to see someone as a whole person and understand how the facets of that personhood impact how they move through life. So I treat people normally, treat people regularly. I think that is really, really important, is that we see each other as whole persons as much as possible. That ties into my third point that I always say for allies: ask questions. We know as queer people, when someone is asking a question because they want to learn and because they want to grow, we also know when people are asking those questions because they're trying to put a nice little fluffy coating around their judgment or around their advice on how we should live our life. So ask questions honestly, vulnerably, and be ready for the answer too. Some of the questions that you'll ask may not necessarily be the comfortable answers that you want, but it's so important to, again, understand us as a whole. So I think those are my three things that I would say would be really important regarding allyship. And I know I said we were going to go in your order, but that ties in really closely to a question that I see about allyship specifically in the medical setting and in healthcare settings. We have that question. Nate said, in a healthcare environment, what are some of the basic steps we can take to ensure that our LGBTQIA+ patients and visitors feel safe? I'm so glad you asked that. Because it does give me an opportunity to brag on the Blue Ridge Health District specifically and the progress that has been made there. So there are a few things that I would highly recommend that we do in medical settings that are pretty stinking easy. I also just realized that I have lost my badge, which I was about to pull that up and show you what we did. And now I don't even have my badge. Hold on, it's there. I'm going to show you how easy this is. All right, so I'm back. I found it. All right. So the easiest thing that you can do to help to start to make that is throw on an ally sticker or a rainbow sticker or some sticker that looks like this. Maybe not this one because it's been on there for a year and it's wearing down. But I can't tell you how many times I've been with a patient and I have my badge on this way with my face and my title and the agency, and I feel all big and bad and professional, and I can tell that they're worried about using certain words, or they're worried about the name, or they're worried about different things. I'll go like this and flip it around, just not like haha, but I'll just be like, oh yeah, oh, ooh. And the minute that this rainbow sticker pops up, queer people like me know I'm a little bit safer. If you don't know everything, you at least recognize my community, my people, and maybe my needs. So the easiest thing that I encourage every single person, provider in the world to do, find yourself a rainbow sticker and put it on somewhere that is visible for people to see. That might be a pronoun button where we talk about what pronouns you prefer. That may be a progress pride flag, or a rainbow somewhere. I always say that we as queer people have evolved and developed the skill to see that rainbow, and that's what our eyes go to. So it seems like a very elementary thing to do, but it makes a huge difference when you're sitting in a provider's office afraid to say, I'm a man who's having sex with men. But when you realize that the people in that environment are at least okay with you talking about that, it makes accessing health a lot easier. When you're a student who's talking to your teacher or your professor and you're afraid to say the kid that you've got a crush on, and you really want to use the pronoun or the name, when you see that your teacher has that rainbow sticker on, you'll know you're a little bit safer to talk about this beautiful emotion of love, or depending on where you are in life. So I say rainbow stickers, posters, flags. If you've got anywhere to hang them up, do it. It doesn't have to be big, but it needs to be visible. So that's the first thing I would say. And we have done that in most of our nurses now. If you come into a clinical space, they're going to have that somewhere on there. Tomorrow is our staff day, and we've made these really cool buttons with pronouns for anybody on staff to wear, to put at their desk, to put in their, the front office, wherever it might be. So that's a really important thing. Another very easy step to take that transcends the walls of your healthcare setting is your email signature and your business cards. So making sure that you have, like you see here under my name, it says my name and my pronouns. If you add your pronouns to your email signature, to your business card, to your social media bio, on your LinkedIn bio, it says something about you and creating that space. When I was looking for a therapist, I looked for a therapist that specifically listed their pronouns in their bio of why they were in therapy. So when someone's looking for a doctor, when someone is looking for a specialist, when someone is looking for an ally, those pronouns say a whole lot. And I would also say something else to do in your medical setting is revamp your intake forms. So if your intake forms say, what is your name? What is your preferred name? What are your pronouns? And making sure that when you're asking questions specifically about anatomy or about how we use our anatomy to, I don't know, say, for example, have sex with people, that we're using terms that don't do what that doctor did to me many years back, that exclude my action and therefore put me at a higher risk for not detecting an infection. So making sure that you're using gender neutral language, asking for their pronouns, asking for their preferred name, and learning about how their body is working for them, super, super, super important. And the last two things, and then we can jump to more questions. This is why I told you to ask questions early on, because I knew that I would have tons of junk to say. So I would also say that if you have the ability to do it, bathrooms are an easy way to redo your space in a way that is welcoming and safe for everybody. So for example, at the Charlottesville Albemarle Health Department, once upon a time, there were 2 bathrooms. One was a men's room and one was a women's room. And what we did was gutted them both out and made 2 humongous single-use bathrooms that have the same fixtures in each one. And they also all have room for wheelchairs, and they have room for a baby changing station. And so if you have the ability to revamp your space, it may not be gutting a bathroom and putting different fixtures in, but it could be taking that sign off the door and instead just saying bathroom, or like putting a sign up there. It was like, you got to go, come here. You know, it does not need to be that stick figure that it has always been, because not all of us look like those stick figures, and not all of us do the things that those stick figures would infer. So it's really important that our bathrooms are a safe space. So a single-use gender-neutral bathroom is primo. And then I would also encourage that anyone on staff do a full safe space training if possible. There are online trainings. There are also organizations and individuals who will come in and do an in-depth dive into how to create safe spaces. Whenever I do them, I always do like an LGBTQ plus 101, like queer 101. This is what we're going to talk about. And we go as simple as, what does it mean to be gay or lesbian? And what is gender expression? And what does it mean to be transgender? And does that have rules to it? We start at the basics and then work all the way down. So I would encourage anyone to do that, and not do it once, but do it at least annually. We change as people, we change as a community, and we change in what we can do as allies and healthcare professionals for our patients. Now, I'm not winning any pageants for short answers today, that's for sure. So I'm gonna let you ask me the next one.
I think I can speak for everyone here when we're ready to go out and change the world now. You just gave us like all of these ideas to go and like rethink the whole world. So I will tell you, Jason, that was the one was my only direct message. So if you want to go through any direct messages you have, or just start going down the ones that are here for everyone.
Yeah, that'd be great. We'll do that.
So many fun questions.
Yeah, I'm very excited for these. And there's one that says, is there a difference between someone who identifies as queer versus gay? And there's also a tag that says, sorry for the ignorance. I am not sorry for that at all. I am so thankful that you ask a question like that, because language matters, and the words that we use can sometimes be as confusing as the life that we live. And so for me, and I will say, if you ask 10 people this question, you'll get 10 different answers. For me, I view the word queer as an umbrella term that basically means something other than what has been normal, expected, traditional, or right. So I view this as the umbrella term that includes all of us under one community, one family. There are some individuals who choose not to use that word. We're kind of in this place in history and in the present where the word is being reclaimed a bit. So early on, that was a word that was used in an embracive way. We were queer people. The word was essentially stolen from us and turned into a weapon. And for many, many decades, that has been a derogatory term that still makes some people uncomfortable. I choose to use it as kind of like a placeholder or like an alternate, like a synonym for a lot of things, as a way to say the LGBTQ plus community, the LGBTQIA plus community, or somebody who's different than. But yeah, so I would say that somebody who identifies as queer could be a gay man, could be a lesbian, could be a transgender person, could be demisexual or pansexual, or any other term that you've ever heard. For me, that's what queer is. When I say that I'm gay or mostly gay, that typically would then mean that I identify as a man who is attracted to other men, or a male who is attracted to other males. But again, the cool thing about a rainbow is that you've got all these set colors with a ton of shades and tones and blends of those colors in between. So when we talk about these labels, they also offer us the opportunity to blend all of our beautiful colors together. So how I identify as a gay man might be different than anybody else who's here who identifies as a gay man, because the word gay might mean something different and the word man might mean something different. But as a general rule, that's how I would see that. All right. I want to be more involved in the community groups and activities in the area. Where's a good place to start? I love that, because you start right here. So what I'll actually do, I will send, Samantha, I'll send you a link to the socials that I myself host. And basically it's an easy form. Like I said, some people on here have hung out with us already. I got tired of hearing people say, I wish I knew more queer people, or what? We have queer people that do that thing here in town? What? And I thought that we needed to do something that was inclusive as possible. So we do 2 or 3 socials every month. I call them Getting Out and About. And we will do things like potluck picnics or hikes, rooftop happy hours, and nights at the theater. We'll do things like bowling. Next month, we're going to do community service, and we're going to go pick up all the trash at a park. So we're making life as beautiful as it can be. Polo is on the list, a Friendsgiving, bonfires, like you name it, and we could do it. And it's basically a way for us to get together regardless of our age, regardless of some people are in recovery and can't be in certain establishments. So great, like let's have some dry events, let's do it. You know, like this week we had 25 people come out to play board games and card games, and it was awesome. And some of us were there for 5 hours. It was a long day. So definitely keep an eye out for that. And you can also, from there, I'll try and connect you with some more resources if you have specific needs within the community, or if there are groups that you want to get to. I would love to connect you to anything that I know of. And there are some establishments in the area that very much want to be that safe space for us. And that's who I partner with. And we also have other groups who are trying to do the same. So I would say support those businesses, and you never know who you're going to run into at that establishment. And of course, we have Seville Pride, which is an organization here. And another really great resource for anybody over towards the Valley is the Shenandoah LGBTQ Center. They are doing amazing work with everything from mental health and endocrinology to fighting homelessness amongst our community, fun fundraisers and shows. But they do a lot of really great work. So I would encourage you to also reach out to them if you have questions about resources on that side of the world. But if you have an area or a need, you can contact me directly, and I'd be more than happy to try and connect you, Todd. So thanks for that.
I'm going to do one more quick, like, shameless plug. So if you're with UPG and you have not seen our DE&I, our diversity, equity, inclusion community calendar, this is a new creation that I've been working on since starting this job. And so I diligently search from Culpeper to Augusta, Charlottesville, Richmond, and everywhere in between for events that are going on in all realms of diversity, equity, and inclusion. And I plug them in so you can find them in one space. So if you don't have that link, please let me know, because I will gladly send it out, because I try and include Jason's events on there. So you'll see those plus a ton more that are going on all over Virginia, really. So throwing that out there.
Love it.
Keep going.
That's great. And I'll also say our very next one is just right up the street. It's on Wednesday. From 5:30 to 7:30, we're gonna have ice cream at Ben and Jerry's. So if you wanna come on out, come on out. All right, let's see. So running down this list, Amy says, can people who aren't part of the community join in the celebrations? And that, again, this is kind of a hot topic because some people are like, why are you here? You're not queer. I am of the camp that says, come on, like queer people wouldn't exist without allies. And it's a way for you to learn. It's a way for you to experience what the happy parts of our life is. My only ask is that if you are going to be an individual who is not part of the queer community, that you not only celebrate with us, but you fight with us and you mourn with us. And it is so important that if you're going to be there for us on our good days, that you're also there with us on the not as good days. So I would say, Amy, come on out, enjoy those celebrations. And then when the celebrations are over, stay and help us clean up. Okay. So that's what I would think there. I'm trying to scroll down a little bit without running. Can you give examples of questions that are more inclusive from a physician or provider's perspective? For example, what questions should that provider have asked at your appointment that would not be assumptive or indicate bias? Love this question, Jennifer, really appreciate that. So instead of saying, hi, Jason, first of all, that I assume you identify as a man, I would ask on that form, what is your identity? What are your pronouns? That's how you would start that conversation. And you can do that on the intake form. So when you as a provider are looking over this chart before you walk into a room, you already know this person may have long blonde flowing hair and beautiful eyelashes and a lot of makeup on, but that is not how they want to be addressed. And so it's really important that we not go off of just like a visual, but we go off of what people are actually telling us. So the first thing I would say is one example of a question to ask is on the intake form of what are your preferred pronouns and what's your preferred name? So that way we get off on the right foot. Specifically when we're talking about partners, for example, in that question of, so does your girlfriend have an STI? I said no, because I didn't have a girlfriend. I had a boyfriend at the time. So questions like we always say like how many partners, or things like that to help judge. Instead of saying, does your girlfriend have an STI? You can say something like, oh, does your partner or one of your recent partners think that they have an STI? And you can go that route of saying, this is a gender neutral way of saying somebody you're having sex with. And then when you get into like the nitty gritty, some places will actually talk about, they'll do a list where they're like, my penis has been in someone's vagina. Or my mouth has been on someone's they will literally go step by step and list all of those. Some places will do a blank. And so it'll be like my blank has been in, on, or around my partner's blank. So then you can put in however you feel. For me in that situation, it would have been more helpful for them to say, does a partner of yours have an STI and that's why you're worried? At the time, now this was a long time ago, they could have also said, are you having sex with men, women, somebody else, everybody? Like who are you having sex with? What body parts are you using with what body parts of somebody else's body? And it for me, the whole foundation is first learning who that patient is, and then just asking them in a kind way, help me to learn about you as my patient. At the end of the day, when someone comes in for care, there are many environmental factors and extenuating circumstances as to why they're there. They are our patient. So respecting their pronouns, their preferred names, that's really important, and that will set the tone. So I hope that answers a little bit. That's great. Amy has put in the Safe Zone project link. So if you all are looking for something else, I'll make sure that I send that to you as well, Samantha. It's called the safezoneproject.com. And I have heard it. I have not myself gone through it, but I have actually heard of the Safe Zone project. And basically that's another way to certify your setting as a safe space, which is really great. And I love to hear that UVA handed out rainbow buttons for badges and pronouns. That's super exciting. And if you did not get in on that, I'm sure you still can. And there are so many places those pronouns can go, which is great. Let me see let's see. We've got, this is a great session. Thank you so much. Thank you so much. I appreciate you saying that. Please know that these 2 CBLs are available to all UVA Health Team members in Workday, delivering compassionate care to patients who are LGBTQ+, and for Epic users, documentation of SOGI data in Epic. There's also information on our safe space training in Workday. Just search for safe space. And those pronoun buttons are available at UVA ID badge office, which is fantastic. All right, let's see. We have a question here that's a direct to me. It says, how would you recommend advocating for a safe space training in a workplace or a clinic? I think the easiest thing to do, which sometimes doesn't feel easy, is just saying, I would like to have this. So we have a great resource here. I'm sure that if you reached out to Samantha and said, I really would love to have a training on this, or Jason was awesome, I want him to come do like a smaller session with us where we can ask and not be recorded on Zoom, you know, or something like that. All you have to do is know who's at your fingertips. And I will say that Samantha, just in the short time that I have had the chance to work with her, is so passionate about this that if anyone is here today and wants any sort of training, I bet you this human being can find it somewhere. So definitely, I would say reach out to Samantha to get that started for anybody who's here today.
You are the kindest. I know our love fest is real right now, everyone. This is very real. I will say that is a really good thing to point out. And if you are at a point where you're not comfortable, please use me as a resource. If you're like, oh, I really want to do that, but I don't know if my comfort level is where I want to step up and say, we need this, I will be your person. And that conversation never happened. I am happy to be the person to step up and say, hey, you know, it's been brought to my attention, this training would be really great. Let me help you get the resources to let it happen in your clinic or in your office. Please use me as your resource. That's all.
Love it. And I'm going to make sure that you're my resource too. That is great. All right, let's see. But sorry, have to run to the next meeting, Jason. Thank you. You're great. I appreciate that so much. Samantha has put into the chat for everybody the DEI calendar. So make sure that you click that team up link there and see all the fun things that are happening and educational things that are happening and important things that are happening. And I think that's a good fact too, is not everything that we do is going to be fun. Not everything we do is going to be comfortable, but everything that we do is helping us create an environment that are both of those things when we are long gone. So it's well worth the investment now. I see one more question here. So I'm going to do that one. And while I answer this question, put any other questions you have in the chat. That would be fantastic. You can send them direct to me or to Samantha or put them in for everybody. Nate says, what are some of the resources available in the community where we can refer patients for free STI testing? Really good question. So the pandemic has really screwed up a lot of the opportunities for free STI testing in our area specifically. I am slightly biased, again, not representing the Blue Ridge Health District in any way, but I happen to know that on the first and third Tuesday of every single month, from 4:30 to 6, they offer free STI testing at a clinic called Test and Go. So you literally go in and they will do all the tests that are necessary for you. And I will talk about those tests in just a second too. And then you get your results back in just a couple of days. So that is always free and it's always happening. So you can go to the Blue Ridge Health District website and get that information, or you can call your local health department and they'll be able to give you information on it. That currently is happening at the Charlottesville Albemarle office on Rose Hill Drive. And it's one of the best. It's so relaxed. Everybody there is like the coolest cats in the games. And so it's really cool to have that space where people can just come out. You can also reach out to other clinics. I know UVA Health, usually the student health section, aside from, you know, somebody who had an experience 10 years ago, is really great as far as knowing what resources are available to students. So that may be something that's good for you to reach out to. And the peer health education team is really cool over there to know resources happening in the area. I always give a shout out to Planned Parenthood as well. While not always free, a really great and inclusive resource for testing. What I would also encourage you in the realm of testing, and I always say this is why it's important to know what body parts we're using with what partners. For just a quick crash course for anybody who's not familiar with STI testing, it's as simple as a blood draw for things like HIV, syphilis, hepatitis B, hepatitis C. That's what you'll get if you come into the Blue Ridge Health District. You can also pee in a cup, and that's going to give you a scan for your gonorrhea and your chlamydia. That's usually where a lot of standard practices are going to stop. What's really important, though, is to know that you can have an infection of gonorrhea and chlamydia in your throat or your butt. And if you don't test those areas, you might test negative and still have an infection there. So if you're using a certain body part, make sure you get it tested. I always say, no matter who you are, give your blood. And if you've got a penis, pee. And if you've got a hole that a penis has been in, get it swabbed. That's how we go. And you get that full battery of tests. And all of those are available at the Blue Ridge Health District too. So if you have any questions about that, like I said, contact the health district or let me know if you need some more specific resources.
I had a question come through to me. So, and it is what questions, and this is kind of away from the medical field.
Perfect.
What questions in general should we not ask a member of the LGBTQ+ community?
That is such a good question. I'm probably the worst person to ask this question to, honestly, because like I said at the beginning, I'm an open book. I live a life of I want to educate, I want to incorporate, I want to enlighten. So if you were to come to me and ask me literally any question, if I didn't answer it from like a professional standpoint, I would answer it in my personal life. But I do think what's really important to think of before we ask a question, we understand the relationship that we have with that person. So I may, as a member of the community, I still sometimes am like, I shouldn't ask that question to that person because we don't have that relationship. So the things that I would caution people against doing, asking questions just because you want to know an answer. Like, for example, when someone says, this is my pronoun, I prefer you to call me she, her, and you say, well, you look like a man, do you have a penis? Or if somebody says, I'm identifying as part of the trans community, and you say, wow, how far have you gone in the transition? It doesn't matter. Those things don't matter. If you never knew me and you came up to me and asked something specific about like my body, regardless of how I identify, I would look at you like you were crazy, because unless I'm inviting you there, you're not going to be there anyway. And so that's one of the like best examples of just respecting people's space. But there are also times where I will ask my friends, or I'll talk with my friends about certain things, whether that be, you know, how I think or how our bodies work or what's happening with them. But if they're my best friend, that's a little bit different than if they're my patient. If I'm passing someone at a Pride festival, it's a little bit different than when I sit beside them in church. You know, and it's really important, especially to understand that not everybody is in the same place at the same time. So what I'm comfortable with you asking me, my brother, for example, who is also part of the queer community, would probably look at you and turn around and walk away because he has no desire to be that educator. And when we're talking about populations that have traditionally been cast down, cut down, held back, some of us identify as the educators. Some of us identify as people recovering. Some of us identify as the support network. So it's really important to remember that in marginalized communities or communities that have suffered oppression for any reason whatsoever, not everyone is going to be comfortable serving in the same role. So for me, I am an educator, but For my brother, he's a survivor, right? So his role is very different in what he can contribute and how he can contribute. So I would definitely encourage you to think about your relationship with that person before you ask a question. But things like, what body parts do you have, or how does that body part work? Those are some of the ones that people are often fascinated with, that I would caution you from being too casual about. I would encourage you to think, if someone asked me this question, would I be okay answering it? And if the answer is no, then come ask Jason Elliott instead of that person you were going to ask. But if you're not willing to answer a question that you're asking, you probably should find a different way to learn that.
So those are my questions. Please, you all, we do still have about 5 or 6 minutes left, so please don't hesitate. If you have another question, it's never too late. If you think of something, also let me put this out there. If you think of something like 15 minutes from now and you're like, oh, I should have asked that question, it's okay. You can email it to me. I'll put my email in the chat. You can email it to me. I'm happy to connect you with Jason so you can get those questions answered. Or if it's just something you're not comfortable having being talked about right now, that's fine as well. But I love the medical questions that have been coming through. I love this has been such a phenomenal conversation. So while we're waiting to see if anyone has any last minute questions, oh, sorry, just got one more. We're getting popular now. Have you ever had to face rejections because you identify as LGBTQ+?
Yes. As a professional, I should not be getting teary-eyed at that. But as a human being, I think it's really important that you know that I have, and it hurts. I have myself, while I have an incredible family, who the majority of them, when I came out, were like, "Oh, girl, this is a whole lot for us to try to learn." Many of them, and most of them, said yes. I did have a couple of family members that I loved dearly growing up, who let me know that I was no longer family to them because of how I identified. That is, when you ask that question, that is immediately where my brain goes to. And the sad truth is that my interaction with a couple of family members who said you're no longer family to us is barely representative of what a lot of people in our community face, because there are so many of us who their entire families have done that to them. So I think about, if a family who has grown up with you can turn their back on you for who you are, imagine what strangers can say. Imagine what those people who don't know you can do. So yes, I have faced that, and sometimes we still do. There are a lot of people in the world who either don't want to interact with us because we're different, or they don't know how to interact with us, and instead of learning, they choose to distance themselves. So yes, I have faced that. I still face that every day. And I recently said in a news interview here in town on the importance of allies, that it's really important that I not only feel safe, but I also feel welcomed and I feel equal. And I think it's really important that we as a community and we as allies make sure that not only are we safe, but that we are welcoming, and that we are making sure that we are equal and equitable in what we do for people who are different than us. Not just queer people, not just people based on race or age or size or location. Every single human that we meet is a human that we can demonstrate what it is to be an ally to them, what it is to be a learner of them, and what it is to be someone who is going to make the world a little more knowledgeable and hopefully warmer and safer for all people.
Okay, I have another really good question that has come through, and I know everyone, we are going to be cutting it close on time.
I'll give a short but efficient answer.
If you have to drop off, if we go a little past 1:30 and you have to drop off, we understand this is being recorded, but this is such a good question. I work in a pediatric clinic department at UVA. I know. what are some ways we can be more inclusive in addressing the end of the family dynamic and group, examples of not assuming mom and dad are the caregivers for like,
Yes.
that is such a good question. I was like, I have to get to it. We have to talk about this.
So important. So I will try to make a quick list of 3 or something like that real quick. First of all, not every child that you are taking care of is going to have a mom and a dad. Some are going to have 2 moms, some are going to have 2 dads, some are going to have 2 parents. Some are not going to have that at all. We're very used to seeing a difference in family structure when it comes to separations or joint custody. We also need to wrap in gender identity of parents into that, because when we as providers assume that you have a mommy and a daddy, it says something to the child that their 2 mommies are not as important to you. Therefore, they are not as important to you. So making sure that we understand that the gender identity or the expression or the relationship of their parents is welcome, helps that child to also feel welcome and safe and acknowledged. So I think that's the first thing. Secondly, also understanding that sometimes children are already going to tell you that's the wrong pronoun. I identify this way. Make sure that you foster that. Make sure that you embrace that. That child is communicating to you how they feel, how they want to be addressed, and how beautiful their future could be if we allow them to shine bright. So I would encourage you to also be inclusive of the pronouns and the desires of that child, of that patient. They are a patient, they are a human being. It just so happens they're a little bit younger in age. And lastly, I would include resources in your environment or your healthcare setting for things like PFLAG. That's the Parents for Lesbians and Gays. It's an incredible organization that specifically works with parents and family members of queer individuals. And to have resources out for parents to reach out to that organization says to your pediatric patients and your parents and your other patients and your staff that we understand that sometimes families have questions too, and they need to be able to grow as a family. So find your local PFLAG chapters or go online to their website. You can also look up Free Mom Hugs and Dad's Hug too. And those are 2 organizations and nonprofits that specifically work with children, with teens and adults whose families have been broken apart because of their identity as a queer person. And they will literally show up to your weddings and your graduations, and they will cheer you on as your mom or your dad or your parent. And so those resources also encourage parents who are bringing their children in for care to be better allies. So those are my 3 things, 4-ish things that I would encourage you to do.
That was awesome. You saw it, like, I have to ask that question. And as a foster mom, I will tell you, like, there's so many types of families out there. So this is such a near and dear part to my heart of all the questions that you need to ask. Really quick, one question did come to me. Do you mind if I share, I'm going to assume you don't, your Instagram social link so people can follow you?
I do not mind that at all.
Okay, I assumed you would not. I wanted to ask first.
I will also tell you, because if we're talking about shameless plugs, I'm going to use my last 30 seconds to tell you all that you have 1 week to vote for me for Seville Weekly's best local advocate. And so make sure that when you click that Instagram link, you'll see a link tree, and the very top one is like, go vote for me for advocate and for influencer. And I have been the bridesmaid so many years. This is the year that a queer person wins that. We've got to do this. But yeah, that's my shameless plug for that. But yeah, find me on social media. I'm on every platform that there is. Probably too much, but I'm on there. And if you feel more comfortable having these conversations over social media, send me a message. My inbox is always open. If you like what you see, let me know. And if you don't, tell somebody else. I don't care. But yeah, I'm there, and I appreciate you sharing that.
Absolutely. Well, we have gone a little over our time, but I am so thankful for all of you who hung with us, because this has been incredible. Just as a heads up, I've already gotten a few emails from people have been popping up about how wonderful this talk has been and informative. So I love that. I was like, guys, it's not even over yet. Just wait. It's going to keep getting better. So thank you to every single person who attended. Your time is so valuable, and the fact that you took time out of your Thursday to be a part of this conversation is huge. Like, kudos to you. Like, that is a huge step in the right direction of having these conversations. A huge thank you to Jason, who I think is now, I like to think he's one of my dearest friends. We've known each other about 2 weeks, and I just love your energy and love what you're doing in this community and in the world at large. So please keep up the fight, and we hope to have you back. I think I'm going to have a lot of requests to have you back with us, which is awesome because I was wanting to do that too. So please, everyone, watch your inboxes. We are going to have, oh yes, we want Jason back already. No questions.
I haven't even left yet and you want me back. That's enough to make a guy feel good.
This is a good sign. So we are going to have more lunch and learns with lots of topics in this coming year. This is just kicking us off. So this upcoming year, we're going to do lots of these with different topics of diversity, equity, and inclusion. And more importantly for me, you'll always hear me talk about belonging. I think that's the most important word, is belonging. So we're going to have lots of these conversations. Thank you, Jason. Again, thank you to everyone who was here. And yes, oh my goodness, I cannot stop without saying a huge thank you. I was so excited to get us started. I forgot to even thank our DE&I council, all of our council members, and so many of them are right here on this call. They have been so welcoming to me coming in, and I've learned so much. So yes, thank them for all the hard work they do, and please reach out to us with any ideas. You can reach out to me or the council with any ideas and anything you want to hear more about. So yes, so thank you, everyone. Enjoy the rest of your day. Bye, everybody.
Have a good one.